Let's take a look at another component of total rewards, employee benefits. In this lecture, we'll talk about the importance of benefits as part of the employee compensation, the types of benefits that are legally required, types of paid leave, as well as other benefits that organizations have at their disposal to match employees' wants and desires. Benefits, like compensation, contributes to attracting, retaining, and motivating employees. The variety of possible benefits helps employers tailor their programs to the kinds of employees they're trying to recruit or retain. Most employees expect at least a minimum level of benefits that the organization will provide as full-time employees. Benefits are also a significant company expense, but employers provide benefits because employees value them, and many benefits are required by law. The important role of benefits is one reason that they are subject to government regulation. Let's first take a look at some of these benefits that are required by law. To start, Social Security is collected through tax on employees and employers, and is set aside for the employee's retirement. Social Security benefits combine several aspects. It combines old age retirement insurance, survivor's insurance, disability insurance, hospital insurance or Medicare Part A, and supplementary medical insurance or Medicare Part B. Employers and employees share the cost of Social Security through a payroll tax. The percentage is set by law. For example, in 2009, employers and employees each paid a tax of 7.65% on the first $106,800 of the employee's earnings. 6.2% of that 7.65% goes to Social Security, and 1.45% of earnings goes to Medicare. There's also unemployment insurance that an employer must pay, which is state regulated, for payments that may be due to an employee upon severance. It focuses on minimizing the hardships of unemployment. It may give payments to unemployed workers, may provide help in finding new jobs, or incentives to stabilize employment to employers. Most funding comes from federal and state taxes on employers. The size of that tax that's imposed on employers is what's called experience rated, which is the number of employees a company has laid off in the past, and the cost of providing them with unemployment benefits that comes up with and comprises that tax. Careful human resources planning that can minimize layoffs and keep their experience rating favorable, of course, is a good thing for the employer. Workers' compensation is another state-regulated benefit and provides for payments upon an employee meeting a certain requirement of work injury or illness. Some of the major categories of those benefits include disability income, medical care, death benefits, or rehabilitative benefits. The amount of benefit income varies from state to state. You'll see generally 2/3 of the worker's earnings before the disability. The benefits are tax-free to the employee. Family and medical leave is provided to new mothers and in some instances fathers for childbirth, adoption, or in the case of medical leave for serious family illnesses. Health care, depending on current legislation changes, may also continue to be mandated by employers. The other aspect of family leave is that employers must also guarantee these employees that go out on unpaid family leave the same or a comparable job when they return to work. Also, if an employee is temporarily unable to perform his or her job duty due to pregnancy, the employer must treat her in the same way as any other disabled employee, for example, modifying tasks or giving alternate work assignments. Non-mandated programs have changed considerably, even in the last couple decades, due to the changes of family structure, political influence, and popular opinion of some of these programs. Also, as previously stated, people once expected to be with an employer for the duration of their working career. Now people have multiple careers and are much more concerned with whether or not their benefits are portable to other jobs. In the past, it was very paternalistic from an employer's standpoint. You saw things like defined benefit plans, or plans that employees didn't have a choice of. Now there's more shared responsibility. The terms of employee cost sharing have also changed. In the past, benefits were relatively low cost. Now costs are escalating so quickly that the responsibility for benefits has shifted, with employers and employees sharing the costs. In the past, there was the mindset of protecting for illnesses, and now we see more wellness promotion programs. Also in the past, we had a single set of benefits with very little employee choice, and now there's much more choice, a cafeteria selection, that is, customizable benefits. An additional benefit is paid time off, which an employer might grant with pay. It includes things like vacation, holidays, sick leave, personal days, floating holidays, days off for jury duty, funerals, military duty, or even time off to vote. In larger organizations, employers often pool time into a paid time off bank. They may put an employee's personal days, sick days, vacation days, and everything they would get from paid time off into one pool, letting the employee then access that pool when they need days off. It's a system that's much more flexible and easy to administer, because in the past, employers were administering sick days and vacation days separately. Now administration counts just the number of days an employee takes against the bank that they have available. Medical insurance is currently mandated in some ways, based on current legislation, of course, but a lot of policies that you'll see cover things like hospital expenses, surgical expenses, or general visits to the doctor. Additional coverages may include dental care, vision care, birthing centers, prescription drugs, chiropractic, acupuncture, etc. There's decisions that an employer can make for all these different ancillary benefits based on their cost, what their competitors are doing, and what their employees value. Medical insurance may be continued after employment through COBRA, not this COBRA, the Consolidated Omnibus Budget Reconciliation Act. It's a federal law that requires employers to permit employees or their dependents to extend their health coverage at their group rate for up to 36 months following a qualifying event, which is typically a layoff or a reduction in hours, or even an employee's death. The amount of time and the qualifying events are very well spelled out in COBRA as to who can receive these benefits and for how long. Employers are continually looking in the area of medical for ways to control costs, because if you've been following any of the news, you know that medical costs continue to escalate. Some of the approaches to controlling healthcare benefit costs include things like offering managed care, working with a health maintenance organization or HMO, which might be a little cheaper than PPO, or even flexible spending accounts, where employers allow employees to put money into a pre-tax basis in a spending account that they can use for unreimbursed medical. In conclusion, this is a huge area of concern for HR to meet employees' needs and manage the cost for the employer. In the next module, we'll look more at some of the other benefits and different ways that HR should be involved.